accept travel grants, they cannot accept holiday trips, they cannot accept CME tuition fee. अभी तक क्या होता था, आप कॉन्फ्रेंस में जाते हो, आपने फिजिशियंस की कॉन्फ्रेंस अटेंड करनी है, फार्मास्यूटिकल कंपनी है, आपका ट्रेवल, आपकी फीस, आपका रजिस्ट्रेशन, आपका होटल स्टे, आपको कार सब देती थी. That has been prohibited from this year. This is a new Medical Council of India regulation which came 2 weeks back. It has been published, it has been cleared, it is now gazetted, it comes into the MCI ethics that they have banned, and this movement came after it happened in the US, and within the same year, Medical Council of India adopted it. That means a doctor cannot accept anything directly or indirectly from a pharmaceutical company for the purpose of education. BRMS, Medical Council of India initiated the concept of BRMS, a 3.5 years mini MBBS course. They are supposed to implement it this year. What they have done is they have designated rural areas. They have designated rural areas. In designated rural areas, what they are saying is anybody who is studying in a designated rural area, who is 12 plus 2, can get a seat in a mini MBBS course called Bachelor of Rural Medicine and Surgery. That person will do a 3 years MBBS, shorter MBBS, and 6 months of internship. He cannot do MD, MS, DM or MCH. The person cannot go abroad because this degree will not be recognized abroad. It will only be recognized by respective states, and they can only practice in respective rural area. They will not be registered under IMR, but in a separate register. This has created some controversy among the medical profession, and Indian Medical Association is yet to come with this view whether to oppose it or not. But this is something which the medical fraternity should know. Something happened in 2009. The government of Delhi came out with a controversial circular. This is something which the medical fraternity needs to fight. And the controversial circular says that if I call an ultrasoundologist in my center to do ultrasound for my patients, then I have to buy an ultrasound machine. That means an ultrasoundologist cannot carry his ultrasound machines to different centers and do the cases there. The corollary of that is कि अगर मैं के अग्रवाल हूं और मेरे को घर में अल्ट्रासाउंड की जरूरत है और मैं किसी अल्ट्रासाउंडोलॉजिस्ट को बोलूं मेरे घर में आके अल्ट्रासाउंड करो, तो मेरे को अल्ट्रासाउंड की मशीन खरीदनी पड़ेगी, तब जाके मैं उसको अलाउ कर सकता हूं. दैट मीन्स जिस प्लेस में अल्ट्रासाउंड मशीन यूज होगी उस प्लेस में वो जिसका प्लेस है ही मस्ट ओन एन अल्ट्रासाउंड मशीन. इट्स अ कंट्रोवर्शियल सर्कुलर व्हिच हैज कम फ्रॉम दिल्ली गवर्नमेंट. I think this is something where we need to debate and we need to fight about it. We don't know why government has come out with a, I'll say this is irrelevant clause they have come out. If I am registered, if I have an ultrasound machine, and if I am registered, my machine is registered, I am registered. Previously, mobile vans were registered, and my mobile van can do cases anywhere. Another absurd thing is why echocardiographer should be treated as ultrasoundologist. Echocardiographer has nothing to do with abdomen. He has nothing to do with pregnancy. If an echocardiographer is doing echo machine, why should he be registered under PNDT Act? Unless he is doing a pregnancy and fetal studies. And for fetal studies, there are fetal medicine specialists. Why should it happen? This should be exempted. The medical fraternity need to come out with views, and we need to fight about that. Another thing which was new in 2009, To prevent mother-to-child transmission, and all HIV-positive pregnant women should start using the drug at 14 weeks of pregnancy instead of 28 weeks. This is a change in guidelines. This is a change in guidelines. We must note that. Cervical screening guidelines also changed in 2009. In its revised guidelines, the American College of Gynecology now recommends delaying the start of cervical cancer screening until age 21. And then screening most patients every other year instead of annually. That means start pap smear at 21. Don't do it every year. Women between 21 and 29 years should undergo screening every 2 years. And women aged 30 or older who have had 3 consecutive normal results can do it every 3 years. This is for normal population, but not the high-risk population. Breast cancer screening also changed in 2009. Earlier, it was 40 years, that at the age of 40, you should start doing mammogram, but now this is not required. Unless a patient is at a high risk, start at the age 50. So these are a couple of changes which have happened. There has been a lot of changes in the city of Delhi. New hospitals came in 2009. Medanta, the Dr. Naresh Trihan's dream became true, started in 2009. Mulcham became a medcity. Batra Hospital showing a lot of changes. BL Kapoor Hospital started functioning. Another drug alert came in 2009. Physicians should carefully prescribe anticholinergic drugs. We are talking about OTC, that means Cosavel, Vicorel, and these drugs to elderly people, especially those with genetic risk of dementia, not able to avoid side effects of, this is not only to avoid side effects of urinary retention, constipation and dryness, but due to associated risk of short-term cognitive effects and dementia in long term. That means we have a habit. In elderly people, he comes with cold. This is the season of cough and cold, and we start prescribing anticholinergic drugs. The anticholinergic drugs should not be prescribed in elderly people because it can precipitate dementia attacks. This is a new warning which came in July 2009. Open for discussion. These were the new things which I thought was something new in the year 2009.